Hi everyone! Today's topic will be on the surgical anatomy of the obturator canal. This is an image of the obturator canal. The obturator foramen is covered by the obturator membrane and two muscles, obturator externus and internus. Only a small canal is left, which eventually is known as the obturator canal. It connects the pelvis to the adductor compartment of the thigh. The obturator canal, canalis obturatorius. The canal is a groove on the inferior surface of the pubic bone, bordered inferiorly by the obturator membrane and the muscles attaching on the edges of the groove. The external foramen of the obturator canal is projected 1.2 to 1.5 centimeters downwards of the inguinal ligament and 2 to 2.5 centimeters outwards of the pubic tubercle. The boundaries of the obturator canal are the obturator groove of the pubic bone above and laterally, and the internal and external obturator muscles and free edge of the obturator membrane inferiorly. The deep pelvic foramen of the canal is directed into the retropubic or prevesical cellular space of the lesser pelvis. The external foramen of the obturator canal lies at the superior border of the obturator externus muscle. It's covered with the pectineus muscle that is to be dissected at the access to the obturator canal. The length of the obturator canal is about 2 to 3 centimeters long. The same named vessels and nerve pass through it. The obturator artery anastomoses with the medial circumflex femoral artery and with the inferior gluteal artery. The contents of the obturator canal. As you can see in the diagram, the contents of the canal are the obturator nerve, the obturator artery, and the obturator vein. First, we'll start talking about the obturator nerve, which, like the femoral nerve, originates from L2 to L4 from the lumbar plexus. It descends along the posterior abdominal wall, passes through the pelvic cavity, and enters the thigh by passing through the obturator canal. The nerve innervates all the muscles in the medial compartment of the thigh except part of the adductor magnus muscle that originates from the ischium and the pectineus muscle, which are innervated by the sciatic and femoral nerves respectively. The obturator externus and skin on the medial side of the upper thigh. Next, we'll talk about the obturator artery. It is also a branch of the internal iliac artery in the pelvic cavity, and it passes through the obturator canal to enter and supply the medial compartment of the thigh. The branches of the femoral, inferior gluteal, superior gluteal, and obturator arteries, together with branches from the internal pudendal artery of the perineum, interconnect to form an anastomotic network in the upper thigh and gluteal region. The presence of these anastomotic channels may provide collateral circulation when one of the vessels is interrupted. Branches and supply of the obturator artery. They are divided into two, the pelvic and extrapelvic branches. Out of the pelvic branches, we have the iliac branches, the vesical artery, and the pubic branch. The iliac branches supply the iliac bone and iliacus muscle and anastomose with the iliolumbar artery. The vesical artery supplies the medial part of the urinary bladder. Sometimes this branch can be large enough to replace the inferior vesical artery and supply its vascular territory as well. And lastly, we have the pubic branch, which arises from the obturator canal. It runs across the pubic bone and anastomoses with its contralateral counterpart and the pubic branch of the inferior epigastric artery. From the extrapelvic branch of the obturator artery, we have three branches, the anterior branch, posterior branch, and the acetabular branch. The anterior branch forms the inner margin of the inferior pubic ramus to anastomose with the posterior branch of femoral artery and the medial circumflex femoral artery. It supplies the obturator externus muscle, hip adductors, and the skin over the medial thigh. The posterior branch supplies muscles attached to the ischial tuberosity, such as the ischio-cavernous muscle, and the acetabular branch traverses the ligament of the head of the femur and supplies the femoral head. This branch usually arises from the posterior branch. Next, we have the obturator vein. The obturator vein begins in the upper portion of the adductor region of the thigh and enters the pelvis through the upper part of the obturator foramen in the obturator canal. It runs backward and upward on the lateral wall of the pelvis below the obturator artery and then passes between the ureter and the hypogastric artery to end in the hypogastric vein. It has an anterior and posterior branch similar to the obturator artery. Clinical significance of the obturator canal. So we have the obturator hernia, which involves intrusion into the obturator canal. An obturator hernia is a rare type of hernia of the pelvic floor in which pelvic or abdominal contents protrude through the obturator foramen. Because of differences in anatomy, it's much more common in women, especially multiparous and older women who have recently lost much weight. And the obturator nerve can also be compressed in the obturator canal. And we also could see the obturator canal, which can be compressed during pregnancy and major traumatic injuries, which later could result in obturator syndromes. And we also, while talking about the damage to the obturator nerve, it can be damaged during surgery involving the pelvis and the abdomen. The symptoms could include numbness and paresthesia on the medial aspect of the thigh and weakness in adduction of the thigh. Alternatively, the patient could present with posture and gait problems due to the loss of adduction. And we also have obturator nerve block, which is used in the management of pain after the lower limb surgery or for chronic hip pain. So the anesthetic is injected inferior to the pubic tubercle and lateral to the tendon of the adductor longus muscle. This procedure could also be carried out under ultrasound guidance. Anatomical variations in the obturator artery. The origin of the obturator artery may significantly vary among individuals. The artery may arise from the main stem or from the posterior trunk of the internal iliac artery, from the superior gluteal artery, or from the external iliac artery. In some cases, the obturator gives off an accessory obturator artery that forms an anastomosis with the external iliac artery. This aberrant obturator artery is usually referred to as the corona mortis or crown of death artery. The name of the vessel testifies to the importance of this feature. During surgical procedures, it can get accidentally injured and cause significant bleeding, which is particularly difficult to stop. In approximately 20% of the population, the enlarged pubic branch of the inferior epigastric artery may replace the obturator artery, and it's referred to as the replaced obturator artery. Thank you for listening.